Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya, and in this show we've been talking about India's fight against COVID-19 pandemic, all aspects of it, be it the technological interventions, the work done on vaccine development of various drugs, and the work being conducted by COVID warriors, be it doctors, health workers, and other administrative officials involved on the ground. So today we will look at one different aspect, an interesting one as well and quite important. That is the effect of COVID-19 on children, be it in the terms of the disease or the confinement due to lockdown, which has been in place for more than 7 to 8 weeks now. For this, we have a distinguished panel of guests with us. Let me first introduce the guests to you, beginning with Dr. Ajay Khera. He's the Commissioner with the Ministry of Health and Family Welfare. We also have with us Dr. Rushi. She's Associate Professor and the Head of the Department of Clinical Psychology at RML Hospital in the National Capital. And we're also joined by Ms. Marwaha. She's the CEO of CRY, that's Child Rights and Youth. Let me begin the show, and let me begin with you, Ms. Marwaha, since your organization has recently done a study on the similar lines, as in trying to gauge the effects of COVID-19 on children specifically. So what does your study say? What are the different aspects in which children are affected by this pandemic, be it the disease or the lockdown or other allied aspects of it?
Hello, everybody. First of all, just to say, I think the first thing is that none of us are in doubt that the lockdown was very much required. And yet, as we went into lockdown, we started asking ourselves this question, what the impact on children, and more importantly, the underserved children that we work with. What was the impact on their access to other things that they need for their themselves? So we did an online survey during the first 2 phases of lockdown, and then looked at education, nutrition, protection. And there are some alarming impact, especially, for example, on long-term health. We all know that immunization is required, and nearly 50% of the households that we surveyed said that they were not able to get the immunization as per schedule. As you know, 63% in the north reported lack of access, and west was 39%. The percentages were a bit better in the south and the east. But we know that this lack of immunization actually has a long-term effect. It is not something where you can have a catch-up camp and suddenly do immunization for infants. So that is to us a huge worry. And 1 in every 4 of the respondents reported non-accessibility to regular health services, which is something I think all of us are listening to. The other large worry for us is really in the area of protection for children. We really do believe that if children are in school and they are learning and they are busy, then the chances that they will be pulled into labor or get married are that much less. Yeah? But almost 60% of parents pointed out that while schools were closed, unlike privileged children who then have access to other things, most of them perceived that they don't have access to extracurricular or even stimulation to their friends. And that has had a huge impact on their psychological well-being and happiness. In fact, in the eastern states, we saw almost a 51%, and across board, almost 37% said that they feel that as parents, this has had a huge impact on their children. Almost 88% of the respondents were really worried about their children's exposure to online activities. While all of us have been saying that this is the solution, but we also know, and there's another CRY study that we had done on the impact of online on children and the issues of safety. This is something that is really worrying parents. Only 43% of the parents reported that they were able to be with their children during their online access or online classes, whereas we know that this supervised access is a good way to actually prevent a lot of the problems. So we did see a lot of impact in the areas that we have looked at. And we are worried about the future in terms of, will this lead to dropout of our children who have not had school for
Hmm.
3 to 4 to 5 months? And once they drop out, will they become more vulnerable to labor, to marriage? They will. So
Okay.
there is some things that we really have to do worry about.
Okay, we'll try and get these answers to all these aspects from Dr. Khera here. But before that, let me go to Dr. Rushi as well to try and find the behavioral aspect of it, the psychological aspect of it, in terms of what Miss Marwa is pointing out. Their study says. Do you also believe, Dr. Rushi, that these are the short-term effects, or maybe some of them can be long-term effects as well?
Yeah, there are short-term effects and there may be long-term effects also. Like the short-term effect is that lot of controversy is going on, that nowadays children, they are, because they are anxious, they are not sure about their safety, they are not sure about the safety of their loved ones. So they are anxious, they are having feeling of loneliness. They are very uncertain about their future, especially the adolescent guys. I mean, the college-going students who don't know, who are very uncertain about their career. So these short-term consequences are that they may have a low mood, like the feelings of depression, anxiety. They have fearfulness, etc. But in future also, it's going to hamper overall their psychological and mental health well-being. And as adults, sometimes what happens that we do overlook their frustrations. We are not able to understand their emotional needs. We are not able to understand their perspective toward this pandemic crisis. Because there was sudden imposition of this shutdown of the schools. So that was quite unexpected, and it also interfere with their overall structure. It also interfere with their overall understanding of the thing, their erratic daily schedules also. So they don't know that how to cope up with this thing. So in
Hmm.
long term also, it may going to hamper. And at right now, even the government is very uncertain. Even they don't know, they don't have clear cut guidelines for the people, that how long the schools are going to remain closed. For
Hmm.
example, for the primary section, maybe that for the another couple of months, the kids are not going to school. So they will be attending their classes from home only. So they are confined to very restricted area. They are not going to out. They are not going outside for eating something. They are not meeting. They are not having in-person interaction with their parents and their peer groups. So that part is also lacking. So that the kind of emotional support, the kind of structure they were receiving in the school, they are not able to get that structure and that atmosphere at home itself, which in the long term and in the short term also, it is impacting their mental health, and in the long term also, it may have a significant impact on their overall mental well-being.
Okay, definitely. A longing for school or the interaction with peer group is something which is very, very common
Yes, yes,
in
yes,
children, because this is a very long period for them to be confined to a particular space in terms of whether it
yes,
is even it is their house right now. Let me bring in Dr. Ajay here. Dr. Ajay,
Yeah.
these are the psychological aspects of how children are affected. But if you look at the other aspect as well, for example, the immunization activity, for the entire 2 months, when the specifically during lockdown 1, 2, and 3, nobody could go out. Even normal immunization processes were on hold for some time, and some guidelines were put forth by the Ministry of Health as well. What do they say, and what is it that the Health Ministry is specifically doing to try and tackle these challenges?
So thank you very much. The as you are aware that during this COVID pandemic, the whole health system has also been affected. And once the health system gets affected, obviously the kind of the services which are being provided to children, which could be in the form of immunization, or which could be in the form of a providing routine medical care to the sick children as well, they have got impacted. Now, what has been done by Ministry of Health, and particularly because improving the health of the children and particularly child survival is one of our mandate, and which is our commitment under the national health policy. And as you know, that India has done quite good in terms of achieving their infant mortality rate. And if for the last 2 3 months, health services are not in a position to deliver their services, whatever gains we have achieved in the past, they will all be lost. So,
Hmm.
keeping that point in mind, the government of India came up with few guidelines, and they have declared few activities as the essential services, and particularly the child-related activities have been declared as essential services, and the guidelines have also been issued. Just to give you, some kind of a background in terms of the COVID pandemic and the child-related intervention, as you must be aware that the country has been divided into different zones. There are parts of the country where the COVID cases have not been detected. I mean, there are more than 50% of the district where not a single case has been reported, and they are called as the green zones. And there are a number of districts where there is a problem, which are called as the red zone and the orange zone. Now, within the red and orange zone, the government of India, sitting with the state government, we have also been able to identify containment zones.
Hmm.
Because why I'm explaining this point is because particularly for child-related services, lot of intervention, lot of activities, they happen by outreach mode. People do not come to the facility. Our healthcare providers go to the community, and particularly when there is a lockdown situation, there is a social distancing norm, the movement of the people is restricted. That means the movement of the healthcare worker is restricted, movement of the public is restricted. Obviously, there is a challenge in delivering the outreach services. And particularly our immunization service is one activity where majority of the vaccines happen during outreach operation. And there is something called, here is that, which is called as the Village Health and Nutrition Days,
Hmm.
VHS. In every village, once a month, all the children who are due for vaccination, they collect at one place, maybe a house of a particular person, or it could be Anganwadi, and where the auxiliary nurse midwife, she comes once a month and gives vaccination to all the children.
Okay.
But because we have to maintain a kind of a social distancing norm. We have to maintain the golden principle of lockdown and all those things. So that's why these outreach activities have been divided into two types. One is in the containment zones, outreach activities have been suspended. But if any child who is due for a vaccination and they report to the facility, the services are not denied. So those instructions have already gone to all the health facilities in the country that if anybody is reporting to a facility seeking services, they should not be denied just because there is a COVID pandemic. But
Hmm.
in terms of the outreach work, at least for areas which are part of the green zone or which are beyond containment and buffer zone, which I think covers 70 to 80% of the country actually, geographical area. There, the recommendations as per the guidelines are there is something called as the modified VHSND, Modified Village Health Sanitation Nutrition Day, and similarly in the urban area there is a modified Urban Health Sanitation Nutrition Day,
Okay.
VHSND, VHSND. Now in these modified, what is that modification which has happened? Now the modification which has to be happened is that people are to be called not more than 5 to 10 beneficiaries per hour. In the past, what used to happen that all these families whose children are due for vaccination, they used to come to a place that VHSND and
Hmm.
get vaccination done. But now they have been instructed that they should be called by appointment, a kind of a staggering approach. For first hour 9 to 10, these five families will come, 10 to 11, those families will come, and then even if the families 5 to 10 come, they have to maintain a social distance. So
Okay.
that concept has been clarified to them. But
Okay.
in the containment zones, there is no outreach session.
Okay.
These are the guidelines, which have been sent
Okay.
across the country. And even where sessions were happening once a month, if number of children are more in that community, they have been asked to conduct session twice a month. So number
Okay.
of
So,
yeah.
these are quite detailed, ones, and specifically to take care of the immunization process and the outreach activities so that they adhere to the norms as well, and these services are also provided to children. One more aspect, and I'll go back to Dr. Rushi on that, in terms of the effect of this pandemic on children, is the disease itself. How has that been, happening, and what are the findings there? Although largely it is being said that children are not very susceptible to it, perhaps. But what does the medical science say?
See, lot of research that shows that the children under the age of 12 years, they may have this. I mean, they are prone to this disease, but beyond 12 years, they have very good immunity. So it's very difficult to say because a lot of research, day by day, a lot of research is coming. So it's difficult to say. The only thing what parents can do, that we have to work very hard on the to increase the immunity of our kids. So we have to give that diet to our kids. We have to work hard on overall perspective of, on the overall perspective. We have to look forward for their overall health, not only the mental health. I mean, it is all about the physical health also.
Okay. So it has to be overall health as well. Let me bring in, Miss Marwaha here. Miss Marwaha, this seems like a bit of a catch-22 situation for the parents and the guardians or the caregivers for children, because they understand the gravity of the situation, as Dr. Rushi was pointing out, and they will have to, boost the immunity levels, prepare children as well so that they follow the guidelines, social distancing, wearing face masks and all that. And this perhaps also may create a sense of fear in the mind of the children, and that affects their mental health as well. So what's the best way out here?
Can I just say a little bit before about, I'm not a medical doctor, but one of the worries that we have is that in the communities that we serve, which are very poor, migrants, returned migrants, we already have a problem of malnutrition. Right? All of us know that the government statistics say that almost 30% of our children broadly under 5 are malnourished. So our big fear is that when you're malnourished, your immunity is hardly strong. And therefore, this set of malnourished children and malnourished families may actually be more susceptible to COVID. So we've already got a problem there. And as you know, a lot of the very poor are sustained by the rations that they get from the ICDS as well as the midday meals from schools. So a lot of work has been done by government, especially I feel like we should salute the frontline para-health workers, the Anganwadi people, the ANMs, they've done an amazing job in making sure that these take-home rations are being delivered, and that too very much at their personal safety. So I think at this time I feel we should all be deeply grateful to these most underpaid section of our caregiver community for really just going out there and making sure that food is happening. To answer your question, yes, I mean, there is a huge impact on children's, for example, social skills. There is a lot more that children do in school than just learn math and English, right? There is sociability, there is negotiation, there is, so we are really worried about that impact on them, and fear psychosis, so we are already seeing, we are not being able to get mothers in our community to go to hospitals for delivery, which is a very hard one battle. In all these years, we've been trying to get people to go to hospitals, and people are scared. So there are some impact, I think, on how children feel, and we really don't have very widespread or cheap counseling services available. So yeah, that's going to be a worry.
That's an
That is
important point out
it's
there.
a
And Dr. Rushi,
yeah,
yes, I'd like to come back to you on this aspect. That catch-22 situation which I was earlier talking about, and the way out. Counseling sessions or
yes.
their lack
So
of
basically,
entire framework there. So what's the way
yeah.
out here? How do we tackle this
Yeah.
situation?
So first of all, so I'll begin from that discussion only that they will remain in the phase of anxiety or fear. So it will adversely affect their immune system. So first of all, it is our duty that we have to be very sure about that we have to provide a practical explanation of all about their anxieties and fears. We have to pay attention to understand them, to understand their perspective.
Hmm.
So let them freely express their anxieties, let them freely express their fears, their understanding. Then it is our responsibility to clear all the misunderstandings, And then another important part was that we have to put a positive slant on everything. We have to explain them the benefits of this lockdown, because that we can spend time together, with each other as a family, then bonding together, then, having a personalized communication with the
Hmm.
children. All these things were very important, like ma'am was saying. So now this is a phase when we have to put a lot of, attention to the overall development of the child, the social skill part of the child, enhancement of their decision making, problem solving skills, and all. What parents can do wonderfully, they can do this job at home also. So it's
Hmm.
not only the achievement of the academic grades only. So we have to think a lot about, I mean, one step beyond that. So a social skill can be incorporated into their structure, so that can also directly and indirectly can help the overall development of the child as a whole, and that can also help them in the enhancement of their immunity level also.
Okay. Dr. Ajay, from the government's perspective, an institutional framework obviously is in place to go ahead and take care of the needs as far as child psychology is concerned, or their psychological needs, or the effects like these. But in times like these and testing times like these, when the focus is somewhere else, we tend to go ahead and miss these aspects. So what in terms of strategy has been done or will be done in the time being to go ahead and take care of these aspects when we talk about the effect of pandemic on children?
To be very frank, because this pandemic, which has happened all over the globe, and the health ministry is also very conscious of the fact that there is a psychological impact on children, and we are also concerned about even the psychological impact which even the health workers are facing. So psychological stress is of a different population groups. So, keeping that priority in mind, that need in mind, the government of India has come up with the kind of a helpline, and there is a dedicated helpline which helps you in sorting out many of these stress related questions. That's one approach which is being followed by different states.
Hmm.
These states have made their own helpline where you can ask questions, you can clarify doubts. But the third thing which I want to emphasize in the context of child and adolescent health, that we have a big umbrella program which is called as the Rashtriya Kishore Swasth Karyakram. So
Correct.
on Rashtriya Kishore Swasth
Yes.
Karyakram, we have across the country around 2,000 dedicated counselors, because this psychological stress is quite a common problem among adolescent population. As per the available data, even 25 to 30% of the adolescent, they suffer from some kind of psychological disorders. But
Hmm.
during times of COVID, this percentage may become even 50%. But there is a system already exists. We have dedicated counselors, and our counselors have been now across the country have been asked to provide dedicated counseling, maybe through the helpline, or they have a dedicated, kind of a adolescent friendly health clinics also, where any adolescent can walk in and
Hmm.
ask questions in terms of whatever fears they have in terms of pandemic, and get these resolved. So this system
Okay.
is put in place.
Okay, so there is a system in place. Yes, concluding comments from you, Dr. Rushi, before we bring this to an end.
Hello.
Yes, Dr. Rushi, concluding comments from you in terms of the way forward from here before we bring this discussion to an
Yeah.
end.
Yeah. So I think there should be like apart from the helplines and all, there should be such simple guidelines for the parents, which should be provided by the governments. Then because sometimes most of the time what happens that it is there, the problem is there in the parents. So they themselves are struggling with lot of things. So they are not able to provide that emotional support to the child, what the child is needed by that point of time. So the parents have to work hard on this parameter. So they have to structure the overall daily schedule of the child, and that is what is more important here, that they have to involve the child in preparation of that structure, because it
Hmm.
also gives a sense of ownership to the child. What happens usually, the mistake done by the parents, that they just give them they give them an order that you have to study this time, you have to do this. So they have to sit with the child, they have to prepare a schedule, because it's not a short term thing, it's going to be a long term. So they have to develop a structured schedule where they will have time for everything. And it's not only about studies, like I'm saying. So there should be time for everything. There should be time of praying together. I mean, communicating with each other together, eating together, and playing together.
Okay,
Huh. So
okay,
apart from this, and the most important effort they should make, like making their home a loving and safe environment for themselves and for the child itself.
okay. So,
And they have to look forward to flourish the individual and the unique, aspects of the child. I mean, the unique and the individual strengths of the child, rather than typically just emphasizing to achieve the academic grades and all.
okay,
So
so definitely these are some of the ways wherein the mental health or the psychological health of children can be, perhaps handled or tackled in a much better way in testing times like these. Thank you so much, Dr. Rushi, Dr. Ajay, and Miss Marwa there as well. As all three of them pointed out, it indeed is a difficult time, not only for adults like you and me, but specifically for the children, not only because COVID-19 is a health threat to them, but also because of the environment or because of the confined environment in which we have been living due to lockdown, which has been obviously necessary. Their psychological health also seems to be in a bit of a spot where all of us will have to do a concerted effort, all stakeholders, parents, and teachers as well during the online classes. Children will have to be make to feel wanted and the freedom given to them to do as they please, but obviously following all the norms and guidelines which are required in this fight against COVID-19. Thank you so much for watching Rajya Sabha Television. We'll come back again tomorrow with a different topic. Keep watching RSTV.